Hope comes just when it's needed. Such was the fortune of the family of Prince Osondu Udom at Oguta in Oguta local government area of Imo State when Pro Health International came with a free medical mission supported by the T.Y. Danjuma Foundation. It was a godsend for the family of Prince Osondu Udom.
So I was happy, and I was saying that God has taught this kind of person that decided to use this money for less privileged people instead of keeping it for himself alone. So I was happy.
Father and mother were in the pediatric ward of the General Hospital in Oguta, attending to their young son, Udom Chukwuemeka Goswell, a beneficiary of the T.Y. Danjuma Foundation free medical mission. Goswell had just had surgery for hernia removal. Prince Osondu was in the ward with his son while the mother went home to prepare evening meals for their children at home. Their father had just granted the T.Y. Danjuma Foundation documentation team an interview.
He should continue his good work, since God has taught his mind to help the less privileged ones, and since he decided to help them, that he should continue, that God will be with him and God will guide him more, since he had decided not to use his money alone. Because being a general, retired general, and there are a lot of generals in the country who has gotten their money before him and who decided to use their money alone. But he has decided, because he's got to trust somebody and he has taught him to use the money. I will say that he will continue his good work and God will guide him very well. And that money, God will give him more.
When his wife returned to the hospital, little did they know that as soon as the mother left home, the youngest child, Goodness Udom, a girl of 3, was involved in a domestic accident. She sustained first-degree burns from boiling water which had accidentally poured on her. It was late in the afternoon. One of the medical teams was still in the hospital and quickly attended to her. They removed all the burnt skin, applied the necessary medication to ease the pain and forestall any infection lurking around waiting to attack the little girl.
The mother is quite distressed right now, but she's also feeling a lot better now because we've been able to take care of Goodness as well. The child had what was a first-degree burn, like I said, and we immediately had to give the child some mild sedation and analgesia with an NSAID and an opiate analgesic, and then proceeded to do a thorough debridement of the child's wound, which is removing all the dead skin, because the skin that was burnt is completely denuded, it's dead, it's not going to function anymore. So we have to remove the dead skin, and then we have to make sure we have a very sterile field, so very thorough disinfection of the wound area and a wide area around the wound to prevent any infection.
Help came the way of the Udoms just when they needed it most. The free medical mission at Oguta recorded a huge turnout, a total of 60 surgeries, mostly on women and children, 292 dental procedures, and 27 eye surgeries. In addition, there was general consultation, free drug administration, free laboratory testing, and distribution of eyeglasses for refractive cases. One thing stood out during the 5-day mission. Residents of Oguta sent in volunteers who helped to manage the teeming crowd and ensure that everyone who came out had an equal opportunity to be attended to.
Volunteer by sending, as you contribute money, or you volunteer by going. So most people, like our international partners, at times they send the equipment and material, at times some of them come.
The medical team worked like one big family, always happy to offer assistance where needed. It was a wonderful experience, and the outcome was heartwarming. The T.Y. Danjuma Foundation has supported Pro Health International since 2009 to carry out free medical missions in Taraba and Edo states. In 2013, the partnership moved its intervention horizons to Imo State, in the southeast of Nigeria. It was a welcome development, especially for the residents of Oguta, who came out in large numbers to access the opportunity of free medical care.